Hi, my name is Dr. Story. This is my channel. I give realistic advice based on my experience. What was chiropractic school like? I get this question a lot because people want to be a chiropractor. Sometimes you get young guys or women in college because we live near a college and they ask me about chiropractic school. I'm going to tell you exactly what it's like to go through chiropractic school. Myself personally, I got my bachelor's degree in biology, human biology. That's generally a pre-medical degree. So I majored in pre-med in my undergraduate studies. After my undergraduate studies, then I proceeded to go to chiropractic school. Now, how chiropractic school works is this. In the first 2 years, it's exactly the same as medical school. We spend an entire year cutting up different cadavers, learning anatomy, we learn physiology, we focus on x-rays, we start spending time learning biochemistry, chemistry, biomechanics, pharmacology, general diagnosis, general medical conditions, that type of thing. And as chiropractic school proceeds through the semesters, it progressively gets harder and harder. I personally loved chiropractic school. Chiropractic school was started at 8 o'clock in the morning and we finished at 5 o'clock at night. We had an hour lunch break where most of my classmates would sit outside and have lunch on the park benches and things of that nature near the school. And I just found it to be, I loved learning. I loved learning about the body. It was almost just a dream come true to learn all this stuff regarding health and disease and nutrition and x-ray. I just loved it. Now what happens is at 5 o'clock the classes end, and then I lived near the school, so my friends would come to my house, we'd eat dinner, and then we would proceed to go to the library, and we essentially stayed in the library till 11 o'clock at night when the library closed, and we studied and we helped each other learn how to memorize the stuff that we learned in those lessons in the classes that we had that day. The next day, the same thing occurred. You'd get up in the morning, go to school. School started at 8 o'clock in the morning. It finished at 5. We'd have dinner, go to the library at about 6 o'clock, study until 11, and for about 5 hours. And I personally loved it. I thought it was fantastic. I don't recommend to be married during medical school, chiropractic school. I don't recommend having children during that time. It's way too difficult. The amount of units that you take per semester, it equates to approximately 40, 45, 50, depending on the semester's units per semester. Now, every chiropractic school is different. They depend on their breaks, but the school that I went to, which was Los Angeles College of Chiropractic, we actually did 3 semesters per year. We did not do 3 trimesters. So each semester was 15 weeks. So we were actually in school 45 weeks out of the year, which was an intensive program, and the idea was that school was able to get you out of school quicker. Now, as the school proceeded, then we did a year of internship, and each school has its own locations. We had 3 satellite locations. I personally wanted to get away from the institution of the school, and I did my internship in not Pasadena, Glendale. I did it in Glendale, California, which was a great, I loved it. So in that, it's just like in medicine. You are an intern. You are there to learn from the supervising doctors. So we would go in to a patient, do an examination, do a consultation. The senior doctors would be watching over us, making sure you don't make mistakes or you don't miss anything. It was a teaching institution, and so in these clinics, patients would be there for a long period of time. It wasn't a normal chiropractic clinic. They understood they were there for a teaching clinic, just like a teaching hospital. You're going to be there for a long time. Also, they had opportunities for us to go outside of the clinics and go do charity work, where we would go to the Red Cross, or we would go to various places like churches where they had homeless people that needed medical care, and we worked in with the other nurses and the medical facility, essentially to give free chiropractic care to those in need. And the benefit for the patients was they got free chiropractic care. The benefits to us was we got more and more experience during that. And so that's what chiropractic school is like. Most people don't realize this, that the first 2 years is identical to medical school. I think the difference is, now I have not been to medical school, but I have patients who are medical doctors, and they tell you that, when we compare classes, it's like it was exactly the same. The difference is in the last couple years, whereas in medicine they focus more on pharmacology. Obviously chiropractors don't prescribe medications, so therefore that's not our focus. A lot of the friends that I have that are medical doctors, they didn't get a single class in nutrition. We got 10 classes in nutrition. So that, again, the education shows you really what the differences are. We got a tremendous amount of classes in x-ray analysis, x-ray utilization, MRIs, that type of thing, whereas a lot of the doctors, that's just part of an internship, and that's just not really emphasized. Obviously, chiropractic adjustments, exercises, joint manipulations, joint exercises, joint stretching, all these things are things that we learned that are taken time. We spend time doing that, whereas in medicine they spend time doing other things as well. Now, what's interesting is in chiropractic school, and this is, most people don't know this, is we learned got a very good general medical education. And I say medical meaning that we learned how to do minor surgery, we learned how to do stitches. We were required in school to learn how to do gynecological exams, prostate exams, all those things, heart exams, meaning learning how to read EKGs. Now, most of us in chiropractic school were looking around going, why are we learning this? It's good general information, but to be quite frank, we're never going to use this in our daily practice. The answer is we do somewhat, but it's not really, because I live in California, and you could literally throw a rock and there's medical doctors all over the place. We live in a town where there's a hospital, so I'm not going to be reading my own EKGs or buying an EKG machine and using it in my office. But I do have friends that practice in very remote locations in other states. And I think it was a good education, learning how to do a gynecological exam, learning how to do prostate exams, learning how to do general doctor type of things. And the one thing that was emphasized in our school was that, we're doctors that practice chiropractic. We're not just people that adjust the spine. Now, the funny thing is, out in the general public, and sometimes you get weird comments on YouTube or Twitter or Facebook and things like this, that's all people think that we do. But our education was, we were trained as doctors and we focused on chiropractic, and that's our specialty, and that's what we do. So hopefully this was informative to you. If you're thinking about going to chiropractic school, be prepared. It is literally a full-time job going to the school, and then later in the day you do have to study. So, but if it's something that you think you would enjoy, again, it was just something, it was a passion for me. I loved it. Looking back, it was fatiguing, obviously, and it was very hard, but I really did enjoy chiropractic school. So if you thought this was interesting, give me a thumbs up, subscribe to my channel. If you have any questions at all, ask in the comment section below. I'd be happy to answer your questions.